Good morning, everyone, and welcome to our lecture on quantitative research methods, tailored for our course on healthcare management and social sciences. Today, we explore how quantitative methods provide a robust framework for analyzing numerical data to address critical issues in healthcare and societal contexts. Unlike qualitative research, which delves into subjective experiences, quantitative research employs statistical techniques to test hypotheses and measure variables, such as patient recovery rates or social mobility metrics. This approach is essential for evidence-based decision-making, enabling healthcare administrators to optimize hospital operations or social scientists to inform policy on issues like income inequality. Our lecture will cover a comprehensive outline, including key concepts, definitions, methods, applications, and best practices, ensuring alignment with course objectives to develop rigorous research skills. Ethical considerations, such as safeguarding participant data and ensuring transparency, are paramount, particularly in sensitive areas like patient care or social equity. We'll examine how quantitative methods drive actionable insights, such as improving care quality in Canadian hospitals or addressing disparities in education access. By mastering these techniques, you'll contribute to data-driven solutions that enhance organizational and societal outcomes. Our journey begins with the lecture outline, which provides a clear roadmap for understanding quantitative research's role in healthcare management and social sciences, setting the stage for a detailed exploration of its principles and applications. Following our introduction, let's review the lecture outline to guide our exploration of quantitative research methods in healthcare management and social sciences. This lecture is structured to provide a thorough understanding, starting with an introduction that defines quantitative research and its significance in generating numerical insights. We'll then delve into key concepts and definitions, such as variables, statistical significance, and measurement principles, to establish a foundational knowledge base. Next, we'll explore research methods and designs, including experimental, quasi-experimental, and observational approaches, tailored to healthcare and social science contexts. Applications will demonstrate how these methods address practical challenges, such as optimizing hospital resources or evaluating social interventions. A specific example, like a study on hospital efficiency, will illustrate real-world implementation. Best practices, emphasizing ethical data handling and rigorous methodology, will ensure research integrity. Finally, a summary will consolidate key takeaways, preparing you for your own research projects. This outline ensures a logical progression, aligning with course objectives to foster analytical and evidence-based research skills. Ethical considerations, like protecting participant confidentiality, remain central throughout. The slide sets the stage for our introduction, where we'll define quantitative research and its critical role in healthcare and social sciences, paving the way for a deeper understanding. Building on our lecture outline, let's introduce quantitative research methods, a cornerstone for healthcare management and social sciences. Quantitative research involves collecting and analyzing numerical data to test hypotheses, offering objective insights into complex phenomena, such as patient satisfaction or social inequalities. Unlike qualitative methods, which focus on narratives and subjective experiences, quantitative research uses statistical tools to measure variables, like hospital readmission rates or income disparities, enabling generalizable findings. This approach is vital for evidence-based decision-making, informing policies in Canadian healthcare systems or social programs aimed at reducing inequality. Researchers define variables, independent, e.g., treatment type, and dependent, e.g., recovery time, to test causal relationships. Statistical significance, often assessed through p-values, determines if results are due to chance, ensuring reliability for decisions like resource allocation in hospitals or policy design in social sciences. Ethical considerations, such as obtaining informed consent and protecting participant data, are critical to maintain trust, particularly in sensitive healthcare and social contexts. Quantitative methods provide a structured framework for addressing challenges, such as improving care delivery or understanding social mobility. By aligning with course objectives, this introduction equips you to design rigorous studies that drive impactful solutions. We'll now transition to defining quantitative research, where we'll clarify its principles and distinguish it from qualitative approaches to deepen your understanding. Following our introduction, let's define quantitative research methods to clarify their role in healthcare management and social sciences. Quantitative research is a systematic investigation that collects numerical data to test hypotheses or measure variables, prioritizing objectivity and replicability. For instance, a study might quantify the impact of nurse staffing levels on patient recovery times in Canadian hospitals, providing measurable insights. Unlike qualitative research, which captures narratives and subjective experiences, quantitative methods rely on statistical analysis to produce generalizable findings, such as correlating education levels with employment rates in social sciences. Objectivity ensures results are unbiased, achieved through standardized tools like surveys or clinical trials. Replicability allows other researchers to verify findings, enhancing reliability, e.g., replicating a study on medication adherence across clinics or retesting income inequality models. Ethical practices, such as anonymizing participant data and ensuring transparency, are essential to uphold study integrity. This definition highlights the structured nature of quantitative research, distinguishing it from qualitative approaches that emphasize depth over breadth. Understanding these principles is crucial for designing robust studies that inform healthcare practices and social policies. By mastering this definition, you'll be prepared to apply quantitative methods effectively. This slide transitions to key concepts, where we'll explore terms like variables and statistical significance to build a foundation for practical applications in healthcare and social sciences. Building on our definition, let's explore key concepts in quantitative research methods, essential for healthcare management and social sciences. Variables are measurable attributes. Independent variables, e.g., staff training in healthcare, influence dependent variables, e.g., patient satisfaction. In social sciences, education level independent might affect income dependent. Statistical significance, indicated by p-values, e.g., p less than 0.05, determines if results are likely due to chance, ensuring robust findings. For example, a study might confirm that staff training significantly improves patient outcomes, guiding hospital policies. In social sciences, significance might validate the impact of education programs on employment. Reliability ensures measurement consistency, such as a survey yielding stable results over time, while validity confirms the measure captures the intended concept, like a questionnaire accurately assessing nurse workload or social mobility. In healthcare, reliable and valid measures might track hospital efficiency. In social sciences, they could evaluate policy impacts. Ethical considerations, like ensuring participant confidentiality and transparent reporting, are critical to maintain trust. These concepts form the backbone of quantitative research, enabling precise hypothesis testing and analysis. Mastering them aligns with course objectives to develop rigorous research skills, equipping you to design studies that address healthcare delivery or social issues. This slide transitions to types of variables, where we'll delve deeper into their roles in structuring research for healthcare and social science applications. Following key concepts, let's examine types of variables in quantitative research methods, crucial for structuring studies in healthcare management and social sciences. Independent variables, manipulated by researchers, influence outcomes. For example, in healthcare, the number of staff training hours independent might affect patient satisfaction scores dependent. In social sciences, access to education independent could impact employment rates dependent. Dependent variables measure the effects of these manipulations, providing quantifiable outcomes, such as recovery times in hospitals or income levels in communities. Control variables, held constant, reduce external influences, e.g., controlling for patient age in a study on treatment efficacy to isolate a treatment's effect. Confounding variables, like socioeconomic status, may distort results if not addressed, requiring statistical adjustments to ensure accuracy. For instance, a study on hospital wait times must control for patient volume to isolate staffing effects, while a social science study on education outcomes might account for parental income. Ethical rigor, such as transparent reporting of variable selection and adjustments, ensures study integrity and trustworthiness. These distinctions enable precise hypothesis testing, aligning with course goals of developing analytical skills for evidence-based research. By understanding variable types, you'll design studies that yield reliable insights for healthcare and social science challenges. This slide transitions to statistical significance, where we'll explore how p-values and hypothesis testing validate findings in these fields. Following our exploration of variables, let's discuss statistical significance, a pivotal concept in quantitative research methods for healthcare management and social sciences. Statistical significance determines whether study results are likely due to the tested intervention or merely chance. P-values quantify this probability. A p-value less than 0.05 indicates a 5% or lower chance that results are random, suggesting a meaningful effect. For example, in healthcare, a study might find that a new triage system significantly reduces emergency room wait times, p less than 0.05, guiding resource allocation decisions. In social sciences, a p-value might confirm that an education program significantly improves employment rates, informing policy design. This threshold ensures findings are reliable for practical applications, such as optimizing hospital operations or shaping social interventions. Ethical considerations, like transparent reporting of p-values and statistical methods, are essential to avoid misinterpretation and maintain study integrity. Misuse, such as manipulating data to achieve significance, p-hacking, undermines validity, so rigorous practices are critical. Statistical significance aligns with course objectives by equipping you to evaluate evidence critically, ensuring robust conclusions. By mastering this concept, you'll interpret data accurately, supporting evidence-based decisions in healthcare and social sciences. This slide transitions to reliability and validity, where we'll examine how these principles ensure trustworthy measurements in quantitative research. Following statistical significance, let's explore reliability and validity, foundational principles in quantitative research methods for healthcare management and social sciences. Reliability ensures measurements are consistent across time and conditions. For example, a survey on patient satisfaction in Canadian hospitals should yield similar results if repeated under similar circumstances. Validity confirms that a measure accurately captures the intended concept, such as a questionnaire truly assessing nurse workload rather than general stress levels. In social sciences, a valid scale might measure social mobility accurately, not just income. Both are critical for trustworthy findings. Unreliable or invalid measures lead to flawed conclusions, undermining evidence-based decisions in healthcare, e.g., staffing policies, or social sciences, e.g., education reforms. For instance, a reliable survey might consistently track hospital efficiency, while a valid survey ensures it measures patient care quality, not unrelated factors. Ethical practices, like transparent reporting of measurement tools and validation processes, ensure study integrity. Researchers test reliability through methods like test-retest and validity through content or construct validation, ensuring robust data. These principles align with course objectives by fostering rigorous study designs that support actionable outcomes. By mastering reliability and validity, you'll produce credible data for healthcare and social science applications. This slide transitions to quantitative research designs, where we'll explore structured approaches to applying these concepts in practice. Following reliability and validity, let's examine quantitative research designs, critical for structuring studies in healthcare management and social sciences. Experimental designs test causal relationships through randomization and control groups. For example, a healthcare study might randomly assign patients to new versus standard treatments to measure recovery rates, ensuring comparable groups. Quasi-experimental designs, lacking full randomization, compare naturally occurring groups, such as hospital departments implementing a new policy versus those that don't, useful in real-world settings. Observational designs study phenomena without manipulation, like analyzing patient wait times across clinics or tracking income inequality trends in social sciences. Each design suits specific research questions. Experimental designs provide strong evidence for causality, ideal for testing treatments, while observational designs offer insights into natural patterns, like social behaviors. Ethical considerations, such as obtaining informed consent in experiments or protecting privacy in observational studies, are vital, particularly in healthcare. Transparent reporting of design choices ensures study integrity and replicability. These designs align with course objectives by equipping you to select appropriate methods for robust, evidence-based findings. Understanding their strengths and limitations supports practical applications in healthcare delivery and social policy. This slide transitions to experimental designs, where we'll delve into their structure and application in testing hypotheses for healthcare and social science research. Following research designs, let's explore experimental designs and quantitative research methods, pivotal for healthcare management and social sciences. Experimental designs use random assignment to place participants in control and experimental groups, ensuring comparable groups to minimize bias. The researcher manipulates the independent variable, for example, a new therapy in healthcare, to observe its effect on the dependent variable, such as patient recovery time. A study might test a new triage system's impact on wait times in Canadian hospitals, with the control group receiving standard care. In social sciences, an experiment could assess an educational intervention's effect on employment rates, randomly assigning participants to training or no training groups. Randomization strengthens evidence for causality, making experimental designs ideal for testing hypotheses about treatment efficacy or social interventions. Ethical considerations, like ensuring informed consent and minimizing participant harm, are critical, especially in healthcare settings. Transparent reporting of procedures, including randomization methods, enhances study integrity and replicability. These designs align with course goals of developing rigorous research skills, enabling precise conclusions for policy and practice. By mastering experimental designs, you'll address complex issues like care quality or social mobility effectively. This slide transitions to quasi-experimental designs, which adapt experimental principles for settings where full randomization is not feasible. Following experimental designs, let's discuss quasi-experimental designs and quantitative research methods for healthcare management and social sciences. Unlike experimental designs, quasi-experimental designs lack full randomization, using naturally occurring groups instead. For example, a healthcare study might compare patient satisfaction in hospital departments with different staffing models, where random assignment of staff is impractical. In social sciences, researchers might evaluate the job training program's impact on employment by comparing participants to a similar non-participant group, without randomizing access to the program. These designs are practical in real-world settings, offering insights into causal relationships despite less control over confounding variables, like patient demographics or socioeconomic status. Ethical practices, such as ensuring participant consent and transparent reporting of group selection, maintain study integrity. Quasi-experimental designs balance methodological rigor with applicability, aligning with course objectives to develop practical research skills for evidence-based decisions. They are valuable for studying healthcare efficiency or social interventions, though researchers must use statistical controls to address biases. By understanding these designs, you'll tackle real-world challenges where randomization is infeasible, such as hospital policy evaluations or community programs. This slide transitions to observational designs, which explore phenomena in natural settings, expanding our toolkit for healthcare and social science research. Following quasi-experimental designs, let's explore observational designs and quantitative research methods, essential for healthcare management and social sciences. Observational designs study phenomena without manipulating variables, capturing data in natural settings to identify patterns. Common types include cohort studies, tracking groups over time, e.g., patient outcomes post-discharge from Canadian hospitals, cross-sectional studies, analyzing data at one point, e.g., hospital wait times across clinics, and case control studies, comparing groups with and without an outcome, e.g., factors associated with readmissions. In social sciences, a cross-sectional study might examine income inequality across Canadian regions, while a cohort study could track education outcomes over years. These designs identify correlations, like staffing levels and care quality, but are less robust for establishing causality compared to experimental designs. Ethical considerations, such as protecting participant privacy through anonymized data, are critical, especially in healthcare. Transparent reporting of methods ensures study integrity and replicability. Observational designs align with course goals by providing flexible methods for real-world research, informing policies and practices. Researchers must account for confounders, like patient health status or socioeconomic factors, to ensure reliable findings. This slide transitions to survey designs, which offer a structured approach to collecting data for quantitative analysis in healthcare and social sciences. Following observational designs, let's examine survey designs and quantitative research methods, widely used in healthcare management and social sciences. Survey designs collect data through questionnaires or structured interviews, measuring attitudes, behaviors, or characteristics. For example, a healthcare survey might assess patient satisfaction with hospital services, using standardized questions to quantify experiences. In social sciences, a survey could measure public perceptions of income inequality or education access, providing numerical insights into social trends. Surveys require reliable instruments, yielding consistent results, and valid instruments, accurately measuring the intended concept. For instance, a reliable survey consistently captures nurse workload, while a valid survey ensures it measures workload, not stress. Ethical practices, such as obtaining informed consent and ensuring respondent anonymity, are essential to maintain trust, particularly for sensitive topics. Surveys can be cross-sectional, capturing data at one point, or longitudinal, tracking changes over time, like patient feedback or social attitudes. Designing effective surveys involves clear questions, pilot testing, and bias avoidance, aligning with course objectives to develop rigorous data collection skills. Researchers must address response biases, like non-response, to ensure trustworthy findings. This slide transitions to sampling in quantitative research, where we'll explore how to select participants for representative and reliable data in healthcare and social science studies. Following survey designs, let's discuss sampling in quantitative research methods, a critical component for healthcare management and social sciences. Probability sampling, such as simple random or stratified sampling, ensures each population member has a known chance of selection, enhancing representativeness. For example, a healthcare study might randomly sample patients from a hospital database to assess care quality, ensuring generalizable findings. Non-probability sampling, like convenience or purposive sampling, targets specific groups, useful for studying rare conditions, e.g., a specific disease but less generalizable. In social sciences, stratified sampling might ensure diverse socioeconomic groups are included in a study on education access, improving representativeness. Sample size is crucial. Larger samples increase statistical power, enhancing the ability to detect significant effects, such as the impact of staffing on patient outcomes or education unemployment. Ethical considerations, like ensuring voluntary participation and informed consent, protect participants and maintain trust. Researchers calculate sample size based on expected effect size and desired power, aligning with course goals of designing robust, evidence-based studies. Inadequate sampling can lead to biased or inconclusive results, so careful planning is essential. This slide transitions to probability sampling methods, where we'll explore specific techniques to ensure representative data for healthcare and social science research. Following our discussion on sampling, let's explore probability sampling methods and quantitative research methods, critical for healthcare management and social sciences. Simple random sampling gives each population member an equal chance of selection, such as randomly selecting patients from a hospital database to study satisfaction, minimizing selection bias. Stratified sampling divides the population into subgroups, e.g., age groups, income levels, and randomly samples from each, ensuring representation. For example, studying healthcare access across socioeconomic groups in Canada. Cluster sampling randomly selects groups, like hospitals or communities, then includes all members within, useful for large-scale studies on regional health disparities or social trends. In social sciences, cluster sampling might involve selecting neighborhoods to study education outcomes, balancing efficiency and representativeness. These methods enhance generalizability, critical for evidence-based decisions in healthcare and social policy. Ethical practices, like transparent reporting of sampling methods and ensuring participant consent, ensure study integrity. Each method suits specific research needs. Stratified sampling ensures diversity, while cluster sampling is efficient for large populations. These techniques align with course objectives to design representative, rigorous studies. By mastering probability sampling, you'll produce reliable data for impactful research. This slide transitions to non-probability sampling, where we'll examine methods for targeted data collection in healthcare and social science contexts. Following probability sampling, let's examine non-probability sampling in quantitative research methods, valuable for healthcare management and social sciences. Convenient sampling selects easily accessible participants, such as surveying nurses during a hospital visit, but risks bias by overrepresenting available groups, e.g., day shift staff. Purpose of sampling targets participants with specific expertise or characteristics, like experienced healthcare managers for a study on leadership efficiency or community leaders for social policy research. In social sciences, purposive sampling might focus on marginalized groups to study inequality, providing contextually rich data. These methods are less generalizable than probability sampling but are useful when resources are limited or specific insights are needed, such as studying rare conditions in healthcare. Ethical considerations, like ensuring voluntary participation and transparent reporting of sampling rationale, are critical to maintain trust and study integrity. Non-probability sampling aligns with course objectives by offering flexible approaches for context-specific research, though researchers must address biases through statistical controls or clear limitations. For example, a convenience sample might inform a pilot study on patient satisfaction, while purposive sampling deepens insights into niche issues. This slide transitions to data collection methods, where we'll explore how quantitative data is gathered to support robust analysis in healthcare and social sciences. Following non-probability sampling, let's explore data collection methods and quantitative research methods, essential for healthcare management and social sciences. Surveys and questionnaires collect broad data on attitudes or behaviors, such as patient satisfaction in hospitals or public perceptions of social policies in Canada. These tools use standardized questions to quantify experiences, like satisfaction scores or opinions on income inequality. Clinical measurements, such as blood pressure, heart rate, or recovery times, provide precise data on health outcomes, critical for studies on treatment efficacy or patient care quality. Secondary data, drawn from existing records like hospital databases or census data, offer cost-effective insights, such as analyzing readmission rates or social mobility trends. Each method requires reliable and valid instruments to ensure data accuracy. For example, a survey must consistently measure patient feedback, While clinical tools must accurately capture health metrics, ethical practices, like anonymizing data and obtaining informed consent, are essential to protect participants, particularly in sensitive healthcare and social contexts. These methods align with course objectives by providing quantifiable data for evidence-based decisions in healthcare delivery and social policy. Researchers must select methods that align with research questions and ensure data quality. This slide transitions to survey design principles, where we'll examine how to create effective tools for reliable data collection. Following data collection methods, let's discuss survey design principles in quantitative research methods, vital for healthcare management and social sciences. Surveys require clear, unbiased questions to elicit accurate responses. For example, a healthcare survey might ask, "How satisfied are you with your care?" avoiding leading phrasing that could skew results. In social sciences, questions on income inequality should be neutral, ensuring respondents provide honest feedback without influence. Pilot testing is essential to ensure reliability, consistent responses across administrations, and validity, measuring the intended concept, like patient satisfaction rather than general mood. For instance, a pilot test might refine a survey on nurse workload to ensure clarity. Ensuring anonymity encourages honest responses, especially on sensitive topics like healthcare experiences or social attitudes, fostering trust. Ethical considerations, like voluntary participation and data protection, are critical to maintain participant confidence, particularly in Canadian research contexts. Well-designed surveys provide robust data for analyzing trends, such as hospital efficiency or education access, aligning with course goals of developing rigorous research tools. Researchers must refine questions based on pilot feedback and address response biases, like non-response, to ensure trustworthy findings. This slide transitions to clinical measurement techniques, where we'll explore precise methods for collecting health-related data in quantitative research. Following survey design, let's explore clinical measurement techniques in quantitative research methods, essential for healthcare management and social sciences. These techniques measure physiological or clinical outcomes, such as blood pressure, heart rate, or recovery times, using standardized, validated instruments to ensure accuracy. For example, a study on medication efficacy in Canadian hospitals might use calibrated tools to measure patient recovery rates, ensuring precise data. In social sciences, clinical measurements might assess stress levels in community interventions, like programs addressing social inequality. Standardization ensures consistency across settings. For instance, using the same blood pressure monitor across multiple clinics to avoid variability. Validation confirms instruments measure the intended outcome, such as a scale accurately capturing pain levels rather than general discomfort. Precision is critical. Even small errors can skew results, impacting conclusions on treatment effectiveness or social program outcomes. Ethical practices, like obtaining informed consent and ensuring data confidentiality, are vital, especially in healthcare where sensitive patient data is involved. These techniques align with course objectives by providing reliable, quantifiable data for evidence-based decisions in healthcare delivery and social interventions. Researchers must calibrate instruments and train staff to maintain accuracy and consistency. This slide transitions to secondary data analysis, where we'll examine how existing records enhance quantitative research in these fields. Following clinical measurements, let's discuss secondary data analysis in quantitative research methods, a cost-effective approach for healthcare management and social sciences. This method uses existing data sets, such as hospital records or census data, to generate insights without new data collection. For example, in healthcare, analyzing patient readmission records can identify trends in care quality, like factors contributing to frequent hospital returns. In social sciences, census data might reveal patterns in income inequality or education access across Canadian regions. Researchers must assess data quality, ensuring records are complete, accurate, and relevant to the research question. Outdated or incomplete data sets can lead to biased conclusions, requiring careful validation against study objectives. Ethical considerations, like securing permissions for data use and protecting confidentiality, are critical, especially in healthcare where patient privacy is paramount. Secondary analysis aligns with course goals by leveraging existing resources for robust, evidence-based findings, ideal for large-scale studies evaluating health policies or social trends. Researchers must address limitations, like data age or source bias, through transparent reporting. This approach supports efficient research while maintaining rigor. This slide transitions to data analysis techniques, where we'll explore statistical methods for interpreting quantitative data in healthcare and social science research. Following secondary data analysis, let's explore data analysis techniques in quantitative research methods, critical for healthcare management and social sciences. Descriptive statistics, such as means, medians, or percentages, summarize data. For example, calculating average patient wait times in hospitals or median income in a community. These provide a clear snapshot of trends, like patient satisfaction levels or social inequality metrics. Inferential statistics, including t-tests or ANOVA, test hypotheses to determine if results are significant, such as whether a new treatment reduces recovery time compared to a control. Regression analysis examines relationships between variables, like how staffing levels predict patient satisfaction in healthcare or how education predicts income in social sciences. These techniques transform raw data into actionable insights, guiding evidence-based decisions in hospital management or social policy. Ethical considerations, like transparent reporting of statistical methods and assumptions, ensure study integrity and prevent misinterpretation. Researchers must select appropriate tests based on data type and research questions, avoiding misapplication that could skew results. These methods align with course objectives by equipping you to analyze data rigorously, supporting robust conclusions for healthcare delivery and social interventions. This slide transitions to descriptive statistics, where we'll delve into summarizing data for practical applications in these fields. Following data analysis techniques, let's examine descriptive statistics in quantitative research methods, foundational for healthcare management and social sciences. Descriptive statistics summarize data using measures like means, e.g., average patient satisfaction scores in hospitals, medians, middle value of wait times, and modes, most common response, like frequent feedback categories. Frequencies and percentages show distributions, such as the percentage of patients reporting high satisfaction or households in specific income brackets in social studies. Visualization through charts, like bar graphs for hospital efficiency or histograms for education levels, enhances understanding and communication of findings. For example, a healthcare study might use a pie chart to show resource allocation, while a social science study could use a line graph to depict employment trends. Ethical reporting ensures clarity and avoids misrepresentation, such as using appropriate scales to prevent misleading visuals. These methods provide a clear snapshot of data, aligning with course goals of developing analytical skills for evidence-based research. Researchers must choose measures that accurately reflect the data, avoiding skewed interpretations that could misinform decisions. Descriptive statistics lay the groundwork for deeper analysis, offering insights into trends and patterns. This slide transitions to inferential statistics, where we'll explore how to test hypotheses and draw conclusions in healthcare and social science research. Following descriptive statistics, let's explore inferential statistics in quantitative research methods, crucial for healthcare management and social sciences. Inferential statistics test hypotheses to draw conclusions beyond the sample, using tests like t-tests, comparing two groups, e.g., treatment versus control on recovery time, ANOVA, comparing multiple groups, e.g., patient satisfaction across hospitals, and chi-square tests, analyzing categorical data, like patient feedback categories. In social sciences, a t-test might compare employment rates between education levels, while another could assess income across regions. These tests determine if results are statistically significant, e.g., p less than 0.05, informing decisions like optimizing healthcare delivery or designing social policies. Ethical reporting of p-values and test assumptions, such as normal distribution, ensures transparency and prevents misinterpretation. Inferential statistics align with course objectives by enabling evidence-based conclusions that extend findings to broader populations, enhancing their impact. Researchers must select appropriate tests and verify assumptions to avoid errors, ensuring reliable results. For example, a healthcare study might confirm a new protocol's effectiveness, while a social science study could validate the program's impact on employment. This slide transitions to regression analysis, where we'll examine how to model relationships between variables in healthcare and social science research. Following inferential statistics, let's discuss regression analysis in quantitative research methods, a powerful tool for healthcare management and social sciences. Regression analysis models relationships between variables, predicting outcomes and assessing impacts. Linear regression examines continuous outcomes. For example, how nurse staffing levels predict patient satisfaction scores in healthcare, quantifying the strength of the relationship. Logistic regression handles binary outcomes, such as predicting hospital readmission, yes/no, based on patient characteristics. In social sciences, linear regression might model how years of education predict income, while logistic regression could predict employment status, employed/unemployed. These models provide actionable insights, guiding resource allocation in hospitals or policy design for social equity. Ethical considerations, like transparent reporting of model assumptions, e.g., linearity, and limitations, e.g., multicollinearity, ensure study integrity and prevent misleading conclusions. Regression analysis aligns with course goals by equipping you to analyze complex relationships, supporting evidence-based decisions. For instance, a healthcare study might use regression to optimize staffing plans, while a social science study could assess education's impact on social mobility. Researchers must validate models and address biases to ensure reliable results. This slide transitions to applications in healthcare, where we'll explore how quantitative methods address practical challenges in healthcare management. Following regression analysis, let's explore applications of quantitative research methods in healthcare management, a core focus of our course. Quantitative methods optimize resource allocation by analyzing data like staffing levels or patient wait times, enabling hospitals to improve efficiency. For example, regression models might show how nurse-to-patient ratios impact care quality, guiding staffing decisions in Canadian hospitals. Evaluating treatment effectiveness involves comparing outcomes, such as recovery rates for new therapies versus standard care, using statistical tests to confirm significance. Policy analysis, like assessing telehealth programs' impact on access, informs healthcare reforms, ensuring equitable care delivery. Improving patient outcomes and satisfaction is another key application. Surveys quantify feedback to refine services, like enhancing patient-centered care. Ethical considerations, such as protecting patient data and ensuring equitable interventions, are critical to maintain trust and fairness. These applications align with course objectives by demonstrating how data-driven insights enhance healthcare delivery and outcomes. Researchers must use robust methods, like validated surveys or clinical measurements, to ensure reliable findings that impact decisions, such as reducing readmissions or optimizing budgets. This slide transitions to applications in social sciences, where we'll examine how quantitative methods address societal issues, complementing their healthcare applications. Following healthcare applications, let's examine how quantitative research methods apply to social sciences, another key focus of our course. These methods analyze social trends, such as income inequality or education access, using data from surveys or census records to quantify patterns. For example, regression analysis might show how socioeconomic status impacts academic achievement, providing insights into social disparities. Evaluating interventions, like job training or education programs, involves comparing outcomes, such as employment rates between participants and non-participants, using statistical tests to confirm effectiveness. These insights inform evidence-based social programs, like policies to reduce poverty or improve access to education in Canada. Ethical considerations, such as ensuring participant anonymity and avoiding biased interpretations, are essential to maintain study integrity and public trust. These applications align with course objectives by equipping you to address societal challenges with data-driven solutions, fostering equitable outcomes. Researchers must use robust statistical methods, like regression or ANOVA, to ensure reliable findings that influence policy and practice. For instance, a study might quantify the impact of universal healthcare on social equity, guiding policy reforms. This slide transitions to an example application in healthcare, where we'll explore a specific case study to illustrate quantitative methods in action. Following applications in social sciences, let's explore an example application of quantitative research methods in healthcare management, a study on hospital readmission rates. The study collects data on patient demographics, e.g., age, chronic conditions, treatment types, and readmission occurrences, using logistic regression to identify risk factors. For instance, the model might show that older patients with diabetes are more likely to be readmitted, p less than 0.05, indicating a significant risk factor. These findings inform targeted interventions, such as enhanced follow-up care or patient education programs for high-risk groups, reducing readmissions and improving outcomes. In a Canadian hospital, this could optimize resource allocation, lowering costs while enhancing care quality. Ethical considerations, like protecting patient privacy through anonymized data and ensuring equitable interventions, are critical to maintain trust and fairness. The study uses reliable, validated measures, such as standardized health records, to ensure data quality and accuracy. This example aligns with course objectives by demonstrating how quantitative methods address practical healthcare challenges, supporting evidence-based practice. Researchers must report methods transparently, including regression assumptions, to ensure study integrity. This case illustrates the power of data-driven insights in improving healthcare delivery. This slide transitions to an example in social sciences, where we'll apply quantitative methods to a societal issue, complementing our healthcare focus. Following our healthcare example, let's examine an application of quantitative research methods in social sciences, a study on education and employment outcomes. The study collects data on education levels, socioeconomic status, and employment rates, using linear regression to assess how education impacts income. For example, the model might show that each additional year of education increases income by a significant amount, p less than 0.05, providing evidence for education's role in economic advancement. These findings inform policies to enhance education access, promoting social mobility in Canada, such as funding programs for underserved communities. Ethical considerations, like anonymizing respondent data and ensuring equitable policy recommendations, are essential to maintain trust and fairness. The study uses validated surveys to ensure reliable data, aligning with course objectives of applying quantitative methods to societal issues. Transparent reporting of statistical methods, including regression assumptions, ensures study integrity and replicability. This example demonstrates how quantitative research provides evidence for policy design, addressing inequalities like income disparities. Researchers must account for confounders, such as family background, to ensure robust conclusions. This slide transitions to best practices in quantitative research, where we'll explore strategies to ensure rigorous and ethical studies in healthcare and social sciences. Following our example applications, let's discuss best practices in quantitative research methods, essential for healthcare management and social sciences. Using validated and reliable instruments, such as standardized surveys or clinical tools, ensures accurate data collection. For example, a validated patient satisfaction survey ensures consistent results across hospitals, while a reliable income survey supports social science research. Transparent reporting of methods, including sampling techniques, data collection procedures, and statistical analyses, allows replication and maintains study integrity. In healthcare, this might involve detailing how readmission data was collected. In social sciences, it could mean documenting survey design and distribution. Ethical considerations are critical. Researchers must ensure informed consent, protect participant confidentiality, and avoid data manipulation to maintain trust. In Canada, ethical guidelines emphasize participant safety in healthcare studies and equitable representation in social research. These practices align with course objectives by promoting rigorous, trustworthy research that informs practice and policy. Researchers must pilot test instruments and use appropriate statistical tests to avoid errors, ensuring findings are credible and actionable. By adhering to best practices, you'll produce robust data for healthcare delivery and social interventions, enhancing outcomes. This slide transitions to ethical considerations, where we'll delve deeper into ensuring integrity in quantitative research. Following best practices, let's explore ethical considerations in quantitative research methods for healthcare management and social sciences. Obtaining informed consent ensures participants understand the study's purpose, procedures, and risks. Critical in healthcare studies involving patient data or social science surveys on sensitive topics like income or social status. For example, a hospital study must inform patients about data use, while a social survey should clarify anonymity. Protecting data confidentiality and anonymity, such as encrypting hospital records or anonymizing survey responses, maintains participant trust, particularly in Canada where strict privacy guidelines apply. Avoiding manipulation of statistical results, like p-hacking to achieve significance, ensures study integrity and prevents misleading conclusions. For instance, a healthcare study must report true readmission rates, while a social science study should avoid altering data to exaggerate policy impacts. These ethical practices align with course objectives by fostering responsible research that supports evidence-based decisions in healthcare delivery and social policy. Researchers must adhere to institutional review board standards and transparently document ethical procedures, ensuring compliance with regulations. By prioritizing ethics, you'll produce trustworthy studies that enhance credibility and fairness. This slide transitions to data visualization, where we'll explore how to present quantitative findings effectively in healthcare and social science research. Following ethical considerations, let's discuss data visualization and quantitative research methods, crucial for healthcare management and social sciences. Visualization uses graphs, charts, and tables to present data clearly, making complex findings accessible. For example, bar charts might show patient satisfaction scores across Canadian hospitals, while line graphs could depict income trends in social science studies. Effective visualizations highlight key findings, such as a pie chart illustrating hospital resource allocation or a scatter plot showing education's impact on employment outcomes. Avoiding misleading representations, like distorted scales or selective data display, ensures integrity and prevents misinterpretation. For instance, a healthcare study might use a clear bar graph to compare readmission rates across clinics, while a social science study could use a table to summarize inequality metrics accurately. Ethical reporting requires transparency in visualization methods, such as labeling axes clearly and providing data sources, to maintain trust. Visualizations align with course objectives by enabling effective communication of data-driven insights for decision-making in healthcare and social policy. Researchers must choose appropriate formats based on data type and audience, ensuring clarity and accuracy. By mastering data visualization, you'll enhance the impact of findings. This slide transitions to hypothesis testing, where we'll explore how to structure and test research hypotheses in quantitative studies. Following data visualization, let's examine hypothesis testing in quantitative research methods, essential for healthcare management and social sciences. Hypothesis testing involves formulating a null hypothesis, e.g., No difference in patient recovery times between treatments and an alternative hypothesis, e.g., a new treatment reduces recovery time. Statistical tests, like t-tests, ANOVA, or chi-square tests, evaluate these hypotheses to determine if results are significant, p less than 0.05. For example, a healthcare study might test if a new protocol reduces emergency room wait times, while a social science study could test if education improves employment outcomes. Interpreting results informs decisions, such as adopting new healthcare policies or designing social programs to enhance equity. Ethical considerations, like transparent reporting of p-values and test assumptions, e.g., normal distribution, ensure integrity and prevent misinterpretation. Hypothesis testing aligns with course objectives by providing a structured approach to validating findings, supporting evidence-based practice in healthcare and policy design in social sciences. Researchers must select appropriate tests and verify assumptions to avoid errors, ensuring reliable conclusions. For instance, a significant result might justify a new hospital protocol or a social intervention. This slide transitions to statistical software, where we'll explore tools for analyzing quantitative data in these fields. Following hypothesis testing, let's discuss statistical software and quantitative research methods, a vital tool for healthcare management and social sciences. Software like SPSS, R, and Stata automates complex calculations, such as regression analysis, t-tests, or ANOVA, streamlining data analysis for efficiency. For example, SPSS might analyze patient satisfaction data in healthcare, calculating means and significance tests, while R could model income trends in social sciences, generating regression outputs. These tools also create visualizations, like graphs or tables, to present findings clearly, such as a bar chart of hospital efficiency or a scatter plot of education outcomes. Ensuring accuracy is critical. Incorrect inputs or unverified outputs can lead to flawed results, impacting decisions like hospital staffing or social policy design. Ethical considerations include transparent reporting of software use and validating data inputs to maintain study integrity. Statistical software aligns with course objectives by enhancing analytical efficiency, allowing researchers to focus on interpreting results rather than manual calculations. In healthcare, Stata might analyze readmission rates. In social sciences, R could assess education impacts. Researchers must verify outputs against manual checks to ensure reliability. This slide transitions to limitations of quantitative research, where we'll explore challenges and considerations in healthcare and social science applications. Following statistical software, let's explore limitations of quantitative research methods in healthcare management and social sciences. Unlike qualitative methods, which capture nuanced experiences like patient emotions or social attitudes, quantitative research focuses on numerical data, potentially missing contextual depth. For example, a survey on patient satisfaction might quantify scores but overlook personal stories, while a social science study on income inequality could miss cultural factors. This focus risks oversimplifying complex phenomena, reducing care quality to numbers or social issues to metrics. Large, representative samples are required for generalizability, which can be resource-intensive. Small or biased samples, like convenience samples in healthcare, reduce validity and limit applicability. For instance, a study on hospital efficiency might miss unique contextual factors, while a social science study on education could overlook regional influences. Ethical considerations, like transparent reporting of limitations, ensure integrity and prevent overgeneralization. Researchers must complement quantitative data with qualitative insights when needed, aligning with course objectives to design balanced, rigorous studies. By acknowledging these limitations, you'll produce more robust findings for healthcare delivery and social interventions, ensuring comprehensive conclusions. This slide transitions to mixed methods integration, where we'll explore combining quantitative and qualitative approaches for a holistic research approach. Following limitations, let's discuss mixed methods integration in quantitative research methods, Enhancing studies in healthcare management and social sciences. Mixed methods combine quantitative numerical data with qualitative narratives to provide a comprehensive understanding of complex issues. For example, a healthcare study might use surveys to quantify patient satisfaction, quantitative, and interviews to explore patient experiences, qualitative, offering both measurable outcomes and contextual depth. In social sciences, regression analysis might assess education's impact on income, while focus groups reveal barriers to access, enriching the findings. This approach addresses complex research questions, like improving care quality or reducing social inequalities, by capturing both data-driven insights and nuanced perspectives. Ethical considerations, such as obtaining consent for both methods and ensuring participant privacy, are critical to maintain trust. Mixed methods align with course objectives by fostering holistic research designs that balance rigor and depth. Researchers must integrate methodologies carefully, ensuring neither approach overshadows the other, and transparently report integration processes to maintain integrity. This approach enhances the robustness of findings, supporting evidence-based decisions in healthcare delivery and social policy. By mastering mixed methods, you'll tackle multifaceted challenges effectively. This slide transitions to evaluating research quality, where we'll explore criteria for assessing quantitative studies in these fields. Following mixed methods, let's examine evaluating research quality in quantitative research methods for healthcare management and social sciences. Research quality hinges on reliability, consistent measurements across conditions, validity, accurate measurement of intended concepts, and generalizability, applicability to broader populations. For example, a healthcare study on readmissions must use reliable surveys that yield consistent results and valid measures that accurately capture readmission causes. In social sciences, a study on social mobility requires generalizable findings to inform policy across regions. Statistical power, determined by sample size and effect size, ensures the study detects meaningful differences, such as treatment impacts or education effects. For instance, a low-power study might miss significant staffing effects on patient outcomes. Transparent methodology reporting, including details on sampling, data collection, and analysis, allows replication and maintains integrity. Ethical considerations, like avoiding data manipulation and clearly documenting limitations, are essential to uphold trust. These criteria align with course objectives by ensuring rigorous, actionable research that supports evidence-based decisions in healthcare and social sciences. Researchers must verify statistical assumptions and report findings transparently to ensure credibility. This slide transitions to practical applications, where we'll explore how quantitative research informs real-world solutions in these fields. Following research quality, let's explore practical applications of quantitative research methods in healthcare management and social sciences. In healthcare, quantitative methods inform policy and practice by analyzing data on patient outcomes, resource use, or care quality. For example, regression models might guide staffing policies to reduce wait times in Canadian hospitals, optimizing efficiency. In social sciences, quantitative methods shape interventions, like education or job training programs, by quantifying impacts on employment rates or social mobility, informing policies to reduce inequality. These applications drive evidence-based organizational decisions, such as optimizing hospital budgets or designing equitable social programs in Canada. Ethical considerations, like ensuring data reflects diverse populations and avoiding biased conclusions, are critical to maintain fairness and trust. Transparent reporting of findings ensures stakeholders can rely on results for decision-making. These applications align with course objectives by demonstrating how quantitative methods address real-world challenges, supporting improved healthcare delivery and social outcomes. Researchers must align data collection and analysis with practical goals, ensuring findings are actionable and relevant. For instance, A study might quantify telehealth's impact on access or education's role in equity. This slide transitions to case studies, where we'll examine specific examples of quantitative research driving solutions in these fields. Following practical applications, let's explore case studies and quantitative research methods, illustrating their impact in healthcare management and social sciences. In healthcare, a case study might analyze emergency room wait times in Canadian hospitals using regression to identify factors like staffing levels or patient volume, informing resource allocation to improve efficiency. In social sciences, a study could use survey data to evaluate the job training program's effect on employment rates, guiding policy to reduce inequality in Canada. These cases demonstrate how quantitative methods provide measurable, actionable insights. For example, a healthcare study might show that increased nurse staffing significantly reduces readmissions, while a social science study could quantify education's role in income growth, supporting policy reforms. Ethical considerations, like protecting participant data and ensuring equitable outcomes, are critical to maintain trust and fairness. Transparent reporting of methods, including sampling and analysis, ensures credibility and replicability. These case studies align with course objectives by showcasing real-world applications of quantitative research, equipping you to design impactful studies. Researchers must select robust methods and validate findings to ensure reliability. This slide transitions to our summary, where we'll consolidate key points from our exploration of quantitative methods in healthcare and social sciences. As we conclude our lecture on quantitative research methods for healthcare management and social sciences, let's summarize key points to consolidate your understanding. Quantitative methods quantify phenomena, such as patient outcomes or social inequalities, using numerical data to test hypotheses and inform evidence-based decisions. Robust methods, including experimental, quasi-experimental, and observational designs, ensure reliable findings through structured approaches. Sampling, probability and non-probability, data collection, surveys, clinical measurements, secondary data, and analysis. Descriptive, inferential, regression provide a comprehensive toolkit for research. Applications in healthcare optimize resource allocation and improve care quality, while social science applications shape policies for equity, like reducing poverty or enhancing education access. Ethical practices, such as informed consent, data protection, and transparent reporting, are critical to maintain trust and integrity. Best practices, like using validated instruments and rigorous statistical tests, ensure credible results. Case studies, such as analyzing hospital readmissions or employment outcomes, demonstrate real-world impact, aligning with course objectives to equip you with skills for designing rigorous studies. By mastering quantitative methods, you'll contribute to evidence-based practice and policy, addressing challenges like hospital efficiency or social mobility in Canada. Thank you for your engagement. Our references follow to support further exploration of these concepts and applications. Following our summary, this slide provides references for quantitative research methods, supporting our exploration in healthcare management and social sciences. Research designed by Cresswell, 2014, offers a comprehensive guide to quantitative methodologies, detailing experimental, quasi-experimental, and observational designs, ideal for structuring healthcare and social science studies. Discovering Statistics Using SPSS by Field, 2018, provides practical tools for statistical analysis, including regression, t-tests, and ANOVA, applicable to analyzing patient outcomes or social trends like income inequality. The Tree Council Policy Statement, Ethical Conduct for Research Involving Humans, TCPS2, 2018, outlines ethical guidelines for Canadian research, emphasizing informed consent, data protection, and transparency, critical for maintaining trust in healthcare and social studies. These sources ensure academic rigor and align with course objectives of fostering evidence-based research skills. Researchers can consult these texts to deepen their understanding of methods, From sampling to visualization, ensuring robust study designs. Ethical considerations, like transparent reporting of limitations in methods, are reinforced by these references, supporting trustworthy findings. This concludes our lecture, equipping you with resources to apply quantitative methods effectively in healthcare management and social sciences, driving impactful, evidence-based solutions.